Thank you, Dr. Park. Aloha, and as we say in Guam, Hafaday. On behalf of my director, Mr. James Gillen, we'd like to extend our appreciation to the Hawaii State Department of Health for inviting us here to share our experience with the MERS contact back in June of last year. I have no financial disclosure. I'm a government Guam employee. So real quickly, the outline of my talk today, I'm just going to give a real quick background on our department's organizational structure, our tourism market, as well as the situational awareness at the time, right before the incident occurred on Guam. Then we're going to go over incident summary, the timeline of events. I'll discuss the response efforts that our department implemented to address this situation, but the main focus is definitely the challenges that we encountered, the successes, and then lessons learned or key areas of improvement. So for our Department of Public Health, we are a totally separate entity from our Guam Memorial Hospital Authority. I'll go over a real brief org chart on that. And like I mentioned, these are the other two areas I'll go over for our background. So under our department, we have 5 divisions, and under the Division of Public Health is where our Bureau, Communicable Disease Control, is located. And the other bureau that is a key partner for us in any type of epi-surveillance response is our Bureau of Family Health and Nursing Services, and that's where our community health nurses are housed. Under our bureau, these are all the programs or units that are in there, and as you can see, there is no separate section or program for investigation or outbreak response. Within our bureau, each categorical disease program is responsible for case investigation, disease tracking, contact tracing, outbreak response, and so, that's a lot on our plate for such a small bureau. Guam tourism, like Hawaii, besides the U.S. military, tourism is our second largest economy, and the Japanese market is the main one, but it's been a roller coaster ride for the past several years. However, the Korean market, it's been on an upsurge. From fiscal year 13 to fiscal year 14, there was a 26% jump in the Korean tourism market. And so, yes, we like the money, but again, there are concerns that come with that. Why is there such an upsurge? There's been a big push by our Visitors Bureau to increase the Korean arrivals, and so they've increased the number of flights coming from the 4 different airlines that I have listed here. And Jeju Airlines, the last one, had just started operating direct flights to Guam. And then the most recent data that was just released in this last month was we had a 38% increase in calendar year 15. So yes, we enjoy the benefits of having increased tourists, the money that comes with that. However, that also opens the door to increase possibilities of disease importation. So situational awareness at that time, the day before the event happened, this was the update we got on ProMed Mail Post, which is the International Society for Infectious Diseases information that they broadcast out to the public at large. And there was another resource that was recommended to us from CDC to use for any updates. And so former cases were identified. There were a total of 10 deaths for a combined number of 126 laboratory confirmed in South Korea, which is roughly like a 3-hour flight from Guam. And out of those 10 deaths, we were informed that every single fatality had a pre-existing medical condition. Again, so that was of concern for us. With increasing number of tourists, direct flight, we had to increase our preparedness measures. And so the department sent out numerous MERS information for the various partners, medical community, our airline and airport partners, as well as the general public, just to be on alert. This is what to watch out for. This is what's going on in the region. And then we also distributed a traveler alert. It's something we've done in the past for SARS and H1N1, and this is for inbound passengers coming from Korea, just to let them know you came from the area with MERS. These are the symptoms to watch out for. Please see a doctor if you start to exhibit these symptoms. This is a contact number for the Department of Public Health to call 24/7 in case of any emergency. And then we also started to communicate directly with CDC Honolulu Quarantine Station. For those of you who have worked with Dr. Tai, Naomi, and his staff, they are a great resource, and we really appreciate all their update and guidance that they provide us. This is a sample of the travel alert that we distribute to all the passengers who were coming in from Korea prior to the incident. Now to the meat of it, the day of the event. Actually, it's more like right at the end of the day. As Dr. Park mentioned, something always seems to happen when you're the acting, and right before quitting time, for Guam, our hours are 8 to 5 for Gov Guam, the normal working hours. So I get that call right before quitting time, and I just happen to be the acting administrator for the Bureau of Communicable Disease Control. So it never fails. But it's actually at Guam Customs and Quarantine was flagged first by Jeju Airlines. It was the Korean quarantine station that was refusing their own resident to come back home. So this is an outbound patient. And so you can realize the shock. What do you mean they don't want their own resident to come back home? They've been on Guam for 4 days. What's going on? And so, of course, Jeju Airlines had to comply, and it was a fax that they received right when they were about to board the passenger with his family. A few minutes later, we're contacted, and then I have to, of course, contact my partner, which is the nursing administrator. And then around that time, our director somehow got notified by a local media channel. How was that? We just got notified, but so that was another concern, and I'll bring that up later. It's like, wow, communication is important, but that was a little too fast, right? We didn't even get to directly inform him. He was calling us as we were driving to the airport. I'm like, sir, I was about to just call you. And he goes, no, media called me, and what is this? And so that was a big challenge for us as this event unfolded. We arrived to the airport. Again, our Guam Customs had already relocated the passenger and family to the quarantine room. And just a little background on that, they have to actually walk through our airport to get to this quarantine room. And so that's something that we've been trying to address for a few years already, in that, it's the airport's facility, and they need to kind of help us find a better isolation and quarantine room versus trekking them through the airport for incoming and outgoing passengers that potentially could spread, and make the situation worse. There's been some progress, but we're working on that. We were briefed by our airport police, and then our nurse started to assess the passenger. So as you can see, we already had Guam Customs, we've had airport police, in addition to public health. So where is this leak coming from? Is something that we had to try and figure out. So real quickly, our passenger details. 39-year-old male was on Guam with his wife and children. 4 days, they stayed at one of the popular hotels right on the main tourist area of Guam. But prior to his arrival, he was in one of the hospitals in Seoul, Korea, that had a MERS patient admitted there. And he was there for an unrelated issue, for an injury, for 5 days. And approximately 3 days later, flew into Guam for his family vacation. However, during the course of our investigation, they claimed that no, the family members were not flagged because they never visited the father, the husband, because it was on lockdown because of that MERS patient. So it was only the father going to be restricted to fly, but the family members could leave later on in the early morning flight that they were able to arrange the next morning. 8:40, we finally get a doctor. Let me just go back. About 6:15 we arrive, about 6:45 we finish assessing the patient. A doctor doesn't come until 8:40. We're a small island. It took so long. And so, and you can imagine during this time we were trying to get a hold of our doctor. Our medical director happened to be off island for business travel. Our other full-time medical doctors for our department were on leave. All we had left was a contracted doctor part-time. So the issue was, can this person respond to this public health emergency? And so we were trying to get a hold of a doctor at Guam Memorial Hospital. The administrator at that time, though, refused to send one of his doctors because it's not their problem, it's a public health problem. The individual is asymptomatic. So all I can say is that administrator's no longer there. We have a new administrator at GMH. But those were some concerns. We're a small island. We rely on each other for this partnership. Yet you didn't want to help us when we were in this crisis of not having our own medical physician available to clear. And this is all that the Korean quarantine station wanted, a medical doctor to clear their resident to fly back home. So fortunately, our director stepped in, made calls, and was able to talk to a doctor who had hospital privileges, a contract, but also was a private physician. And so he was able to finally come in after seeing his last patient at his private clinic. Got him cleared. Okay, go ahead, go. We're arranged for that early morning flight the next day. We are fortunate to have on the ground in Guam, a CFO, Career Epidemiology Field Officer from CDC, and he handles all 6 U.S.-affiliated Pacific Islands. We update him, and we go down the chain. He updates Dr. Tai here. But I guess Dr. Tai received additional information, and so that clearance just got null and void because we were informed, nope, can't fly. We're placing him now on the U.S. do not board list, and so he'll have to stay on Guam until he completes his incubation period. For MERS, it's 14 days. Last exposure was June 5th, trying to leave June 12th. So we're looking at June 19th for this individual to be cleared to fly if remains asymptomatic. So I had to ask Dr. Tai, you need to tell my director. I just told him it's all good. We've been given the green, it's cleared to go. Can you tell him, because this is just causing mass confusion. And so fortunately, our director was able to contact the airport administrator, and we had to arrange hotel accommodations for overnight until we can get more information. And so the plan was to have a conference call the next morning with CDC. We needed to define the risk assessment for this individual. We needed to determine were there additional public health measures that we needed to implement. Because we weren't getting much information from the Korean CDC. There wasn't any formal report about contacts. And so that was something that we still had to sift through as we were trying to get this initial assessment of this passenger. As I mentioned, do not board on the US side. And then even relocating this individual became an issue from the hotel because of those rumors started to spread. The hotel manager did not want this individual to stay in their hotel because of the concern for their other guests, which is right. However, it was incorrect information, the rumors that caused this undue panic. And so the issue became, how do we relocate him, and what temporary quarantine site can we relocate him to? Do we have that available? So we implemented active daily monitoring twice a day, which resulted in myself and the nurse administrator face-to-face visits twice a day, morning and afternoon. Public health also recommended that if the patient had any visitors or contact with others, mask him. If he became symptomatic, implement isolation in a negative pressure room, airborne precautions, and then also to obtain a specimen, be it trach, aspirate or induced sputum, serum, or nasal or oropharyngeal swab. And we were going to send it here to Hawaii State Lab because you guys could do the PCR testing, we couldn't. And so that was something that to prepare for if the individual became sick. Because he was asymptomatic, we didn't have to hospitalize at this point in time, but once he started to exhibit symptoms, that was something that we would have to address and relocate him to a hospital for isolation. Press releases. They're good, but they can also be bad if the individuals who are writing the press release are putting erroneous information or don't get input from the lead agency responding to that specific event. We've all gone through our ICS training. It's required within our department. We know to go through our Joint Information Center, but somehow press releases were coming out of our governor's communication office, weren't vetted through us, and oh, Annette, you need to update a press release. What do you mean update? I didn't even do a first press release. I'm still responding to the event. Oh, they already sent one out about 4 o'clock in the morning. MERS on Guam. You know, we're handling it. I'm like, oh, it's not even a MERS patient. It's a MERS contact. Very different, right? And so those are some of the things. Yes, you want to be ahead, be the one out there to address it to the community so that they don't think, oh, why is the government hiding things? They're not being transparent. But the information you put on those press releases are also critical and has to be accurate. And also to avoid potential HIPAA violation. They were putting information on there that we would never put as public health, medical community. We know you don't need to put that he was there for this broken finger. No, we just say he was there for an unrelated MERS situation or injury, but they were, oh, broken finger, this hospital. Oh, we're like, oh my goodness, what? How are we going to fix that? You know, and that's something that thankfully this patient was very cooperative with us. We translated our travel alert to Korean. Again, we had to reach out to our Guam Visitors Bureau, and so that took over a day to get that done. We developed and distributed Guam MERS integrated prevention strategy, and I'll show you on the next slide what that looked like. And then continuous ongoing communication, coordination with CDC. We needed to get updates on what was happening in Korea. Was this passenger really exposed to the MERS patient directly? I mean, what was his level of exposure? Do we need to keep him for the whole, 14-day incubation period? Can he go home sooner? But once he's released, is he going to be, the travel restriction is going to be relifted? We don't want him to stay another day or two waiting for this to be cleared by the federal level. So that was something that as soon as we said he was all clear, they were going to try and put him on the next available flight back home. So I'm sorry, it's a little small, but this was just an effort by our department to calm the fears in the community that it wasn't only public health that was responding to the situation. We had border health involved, so we, of course, our partners, Border Protection at the federal as well as local level were assisting us. It was something then for the providers, their awareness of the situation, increase their infection control and prevention measures, dust off the book if they haven't looked at it in a while, refresh just-in-time training in case we had to move this individual to the hospital, or in case you started to see other worry wells or potential MERS contacts or patients who happen to come to Guam. And now, because of the awareness, they're coming to your facility for, I'm feeling sick and I have these symptoms. Oh, yes, I went to Korea. We actually even had one family that said, oh, yes, I was in contact with this individual. How, when you didn't even know who we were talking about, but a worry well family was already trying to come to the hospital to get evaluated. And the last section, community awareness, that we wanted to say, we need the community's help. Practice that cough etiquette, wash your hands and everything. And if you start to have symptoms or someone in a family, to see your doctor, come to the hospital and get evaluated. Just that it shows it's everyone's responsibility to prevent this MERS situation to escalate. So our challenges, I probably should have had communication on its own slide, because as you can see of all the bullets, this was one of the biggest issues, communication. When we found out that this passenger was allowed to come to Guam, one of the first questions was, why weren't we told? Where's the list of all the potential contacts, stop them from even coming into Guam? And we understood on the public health side that it takes time for a case investigation to determine which ward, how long was this MERS patient in there, who else was in the hospital at the same time. So it's not an easy thing, but yet government wanted that list now. And there's no way we're gonna release that list. Even if public health asks, they're not gonna give it to us. And so it's just something that we had to accept and be prepared for. Those information leaks. Just hours after we were told, there was a post allegedly by a police officer saying, MERS in Tumon, which is our main tourism industry. It's our little Waikiki. Tumon, all the hotels are there. Stay out of Tumon, MERS on Guam. So you can imagine all the backtracking we had to do. We're trying to deal with the patient, and yet now rumors are spreading, and how do we fix that? Because it was wrong information, and it just spread like wildfire, even on, like I mentioned, the press release. Our challenge was our Joint Information Center at our Guam Homeland Security Office of Civil Defense was not stood up. And that was something that is not typically, that it normally is stood up, at least partially stood up, to help us deal with the media, general public, because as public health is dealing, like I said, with the crisis, we have those people, PIOs, public information officers, those who have training in risk communication can help us deal with all the inquiries and the rumors. We had lack of coordination. Like I mentioned, our governor's communication office meant well, but they're not trained in risk communication when a public health issue. Are you going to violate HIPAA information that you're putting out there? Yes, you want to address it because it's tourism, it's our economy, it's politics because now we're dealing with a foreign country. But we also have to make sure that we don't cause undue panic in our community. We actually were able to get CDC subject matter experts to help us craft the second press release. And unfortunately, that wasn't taken into account. The powers that be just said, nope, we're just going to go with what we wrote. We're like, okay, here we are. We're bothering SMEs in Atlanta, Georgia. Time difference, Guam and mainland. I mean, this is their early morning hour, and yet based on our recommendations from public health, you didn't want to implement that and add it into your press release. And so that was something that was, difficult for us to, as public health, we're supposed to be the lead, yet you're not taking our recommendations and advice. Our challenge of lack of pre-identified translator pool. This passenger barely spoke English. And so we had to pull, trying to get a hold of the consulate office. We ended up going through a local Korean Association of Guam, thankfully through the governor's office, special advisor, to get a hold of someone. Can they please help us with translation after we relocated this individual from the airport. And so that's something to consider, especially with our diverse community in Guam and in Hawaii. Have that already. We kind of take it for granted. Oh, okay, they speak English, We did have a response plan for ports of entry, keyword being entry, for inbound passengers, but like I mentioned, we weren't prepared to do with the outbound passenger who was a non-resident of Guam. If you're trying to leave Guam and you're a resident, okay, go back home. You're home. But this is a tourist. Where is he gonna stay, and who's gonna fork out that money for his extended stay? And so that was something that, we had to somehow adjust on the fly. As I mentioned, we didn't have our medical coverage for the department, almost a 2-hour wait trying to track down a doctor who would come and help us. It's just not acceptable, even, for a small island. So that's something that we needed to work on, a lack of physician pool for public health response outside of our department, be it the private sector or from Guam Memorial Hospital, and get that MOU, MOA in writing, work out all the issues of liability, because it's a public health response effort. Our lack of an alternate isolation and quarantine location. From the hotel, where were we gonna put him? We don't have one under the department. GMH's isolation room is within their facility. You don't wanna bring a potential infectious disease person. And again, that information we got from Korea, the 10 deaths were for those with comorbidities, pre-existing illnesses. So why are we gonna bring this individual and possibly expose already, ill patients there? Lack of alternate transportation protocol and resources for asymptomatic contact. When the hotel that housed him overnight said, you need to remove him, we don't want him, they were concerned because of the rumors. The question was, we shouldn't use an ambulance because he's asymptomatic, but their protocol would be to still disinfect, sanitize, which would bring that ambulance down for about an hour to 2 hours. We have limited ambulances on Guam. There was a large gathering down at one of our main beaches, and so are we gonna pull that critical resource for an asymptomatic patient? Government of Guam protocol, you can't transport a non-government employee in a government vehicle. Then they looked at us, the acting, and the nurse administrator, can you guys bring them in our POV? What's the liability of that? So that was some issues that we never had to deal with. And so thankfully our director stepped up and said, I'll take him. Let me move him, and should we mask him? What do we do? And so, as a precaution, mask him in the car and transport him to the temporary alternate facility that was designated for this event. What was really frustrating is we did not have the support from the local consulate. We had to bring it up the chain of command, our director, to the governor's office, and then we were trying to have CDC liaison that was in Korea work with the Korean government to instruct their local consulate, step up. We needed translation, what are we gonna do for is this individual gonna pay for his bill at the hotel? It wasn't his fault that he was denied to go home, and the poor individual ended up having to pay his bill for that overnight stay. And we hope he was able to get reimbursed by the South Korean government, but we're not sure. So that was really frustrating. Our successes, again, our director was in the thick of things only because we needed his help. Acting, I can only do so much, and we had to involve him, and we were thankful that he was involved every day, morning, afternoon, what are the updates? I'll be the one to transport him. What do you need? And I'm gonna call the governor's office or powers that be to get things rolling, calling in that doctor for us, trying to find an alternate facility. We do have an experienced team. We were there for SARS. We were there for H1N1. So we have this good cohesive team from the nursing side as well as our Bureau of Communicable Disease Control. We do have our established response plan and protocols. CQA calls us. We respond accordingly. And so that's something that, it's a good thing that we've had real-life events. We've put that response plan into practice. It's a bad thing because we have real-life events that we have to use this response plan. We have strong support from our partner agencies. We could not have done it without them. Again, it's border health combined with public health. We have our airline partners as well as the airport authority that if they don't notify us, an individual with a potential infectious disease could spread it not just in our airport, but in our community. Our fire department was on standby if need be. Again, that's if, God forbid, that individual became asymptomatic, we were prepared to have to call them up and transport them to the hospital. And again, our Guam Visitors Bureau for translation services, they were helping us because we did not have the support of that Consulate General for a translator, which was pretty, daunting for us. And even just to communicate with the patient on a day-to-day basis. We needed someone to translate for us signs, symptoms, how's your appetite, how are you feeling? So we were able to get a volunteer from that Korean Association, be it over the phone and can you talk to them? And then at one point, towards the end of his quarantine period, we were using Google Translate. He was the one, already by the time we were coming, he was having his translation ready for us on his iPad or whatever. And we're like, oh, okay, he's being proactive, which was really good. And probably because we were the only visitors for him, but that really helped us out. Our governor's chief of staff was critical, and it was baptism by fire for him. He was just appointed right before the event happened. His official start day was June 15th. So over the weekend, it's welcome aboard, sir, and this is the crisis that we have. And he was really supportive and just let me know what you want. Who do you want? I'll call them. And so we're like, okay, sir, hold on. We won't go to that extreme yet. But, knowing that he was prepared to assist us with whatever we needed was very comforting for us, and reassuring for us that, okay, if we hit a wall somewhere that, we have his support. Our private medical partner that stepped up to allow a temporary quarantine station facility, temporary. It was a one-shot deal. If another potential MERS contact came, or sorry, we won't help you, only this one time. And he's a new partner. It's a relatively new facility, and so, we can understand. And the cost of that, you're going to have to limit the area of your facility from your regular employees or your regular patients because you're allowing this accommodation to help public health because we don't have our own facility. US CDC instrumental on the ground in Guam, here in Hawaii, in Atlanta, regardless of the time difference, and even in South Korea. It was the liaison in South Korea giving updates to the Honolulu quarantine station, us via email, and trying to get as much real-time information about the situation in Korea to trickle down to us so we could respond accordingly, adjust what we needed to do to deal with this MERS contact. Our translators, Jeju Airlines, stepped up that night and the next morning when we were trying to move him because, again, lack of that consulate involvement. And so that manager took it upon himself to make sure the passenger made it to the hotel safely. The very next day when he knew we were trying to transport him to the alternate site, he stepped up and came in on his own and to translate so that the individual understood what were we doing, why were we moving him when he was okay at this hotel, the night before. And then again, that volunteer from the Korean Association, it was instrumental for us because communication is key. That passenger had to understand what was going on. And actually, this individual was very cooperative. He mentioned, if I had known I wasn't supposed to come, I would have canceled my trip. And so, again, that was something that, can you imagine if we had an uncooperative individual? The hotel, he could have walked out that night and gone, God knows where, and a potential exposure to others. He could have probably refused staying in that private provider's facility, or just made life difficult, not complying. When he saw us coming, he already put on his mask. He knew the drill already by the second day that, okay, put up his hair, okay, no, food is good, everything, just the little sign languages to communicate signs, symptoms, appetite, and how is he going, how's he doing for that day. Our lessons learned, key areas of improvement, there's a lot. We still need this alternate isolation and quarantine. There were suggestions of a housing, our local housing is called GURA, where for low-cost housing, to use one of their empty units. The problem was no security. What's the comfort level? Is it a completely abandoned building? There's no furniture? How about cable, internet for this individual? You can't quarantine someone and not give them the basic comforts. That was out the door. Okay, what about our skilled nursing unit? Oh, but that requires renovation on one side, the wing that's not being currently used. Well, you gotta renovate all the air con and so that's not feasible for a current event. It needs to be done prior to something happening. And so again, God forbid, knock on wood, something happens, will that primary provider step up and provide that temporary housing again? We don't know. Or quarantine site, I'm sorry. We need to update our existing plans. Again, we focus on coming in. We don't focus on those being restricted to fly out who are non-residents. So we need to address that and update that in our plan. What are we gonna do? Where are we gonna put them? Do we have these agreements in place? Incorporate our daily monitoring. In one situation of infectious disease, they said, oh, just self-check, self-monitor, call them on the phone. But for this situation, he's a MERS contact. No, you need to do face-to-face. Okay, so we're trying to decipher this. When it happens, we should already know prior to, okay, nope, daily monitoring, phone call, no problem. Nope, the situation, daily monitoring, face-to-face, what will be the times that we're coming, already set in place. The issue, again, of quarantine location transportation, alternate transportation, have these contracts already in place. But if you don't have a contract in place, this government for you can take 6 months for a contract to be implemented, cut. So we need to have an alternate transportation protocol. We have medical transport, private companies. Is that a resource that we can tap on? We need to have that MOU and MOA in place prior to any real world event happening again, okay? Especially if it's just asymptomatic. Are you going to alter the government of Guam policy that during the course of official duties, we will now be allowed to transport a non-government employee in our government car? So that's something that still needs to be addressed and reviewed. Review and strengthen our existing local quarantine response law. Currently, how it's written is 10 days of isolation or quarantine. Involuntary, if you go beyond the 10 days, the maximum is 30 days, but you need to get the Superior Court of Guam to write that order. So can you imagine that an individual comes and the incubation period is more than 10 days and we have to isolate or quarantine them, but yet we have to go through the court because it's more than the 10 days that's written in the law? And so that's something that we will be addressing in that based on CDC guidance for the specific disease or condition. These are the quarantine or isolation periods based on the current guidance given to us. So we need to have some flexibility in that law. And this is basically my last slide. At least partially activate that JIC, Joint Information Center. Let them deal with all the communication issues while we can focus on our public health response efforts. I was getting calls from San Francisco from an individual claiming, oh, I'm from Region 9, HHS. I heard about your MERS. And this was just the very next morning. How did you hear about that, sir? And how do I know it's really you? Not that I'm saying you're lying, but I can't confirm who you are over the phone, and I'm not about to release sensitive information to you. So I'm having to call our PIO and say, can you please? News media is calling me. I have someone claiming from San Francisco, Region 9. I have Mariana's Region Fusion Center calling me. Can I just deal with what I need to for daily monitoring? And, so those are some things that, again, they mean well, but we've got to have this chain of command, and we've been trained, go to the JIC. We refer you to the JIC, so you should go to the JIC so we can deal with our public health response. Again, we need to develop that physician pool. Not having that backup, it was like a perfect storm. Public Health Emergency Preparedness Program Manager was off island. My boss was off island. Our medical director was off island. Our full-time doctors were off island. I was just like, what's going on? So, be prepared for the worst. And then have this collaboration and partnership strengthened with your foreign consulates. The fact that we needed that translator, the fact that maybe they could have potentially housed them somewhere for us that was comfortable, had the basic needs. That's something, again, we need to establish prior to any event. And so, Japan, Korea, the FSM consulate, Marshall Islands, Palau. Taiwan is being a market that they're really pushing for. Same thing with Russia for us. So can you imagine if all these different needs for translation and housing? So we need those things in place prior to any real-life event. Because of all those information leaks and the rumors that were spread, our governor had to implement an executive order for social media policy for the executive branch. The alleged police officer who posted on social media, the leak to the press before public health could even tell their own director. We had other GovGuam agency heads. They meant well, but they were posting their opinions about this MERS situation on social media. You are not public health, you are not the hospital, so who are you to put in your 2 cents about a public health medical situation? And so that's something that the governor had to fix, because they may have meant well, but you're putting your opinion that may not be based on factual information, you're causing more problems for public health to deal with. And so it applied across all agencies in the executive branch, for all employees and for volunteers. And that should you violate this, it is grounds for termination. And so that's something that, again, came after the fact, but at least now, moving forward, should there be another public health emergency, they could be held responsible for their actions or their posts. Any questions? Yes, yes, sir?
Of the higher level folks being away at the same time, were there any policies afterwards saying that for non-essential travel, you can only have so many of these folks away at one time?
I wish. There were some gone for personal reasons, some for business travel. And I actually, as the acting, just prior to my boss leaving, was Annette. This is the updates for our points of entry response plan with Guam Customs. We already inserted for, we updated from Ebola. Now these are the new inserts for MERS. And so it was real crash course for me, as well as for our nursing administrator. But within our bureau, it's, we always try to practice 3 deep for a backup to the backup to the backup. And like I said, unfortunately, it always seems to be me when I'm acting. And so, and our director actually wanted to keep the information as we dealt with this quarantine of this passenger. He kept it tight because of the rumors that had already spread. And so the JIC didn't stand up, so he took it upon himself and said, you know what, we're gonna keep this in-house, keep it tight. Only the chief of staff is who I'm going to report to. And he created a WhatsApp just for the key individuals responding. We did have a FEP coordinator there who assisted us. Myself, the nursing administrator, our PIO, and the director were the only ones on this WhatsApp because of all those information leaks. And he goes, if they have a problem with that, I'll take the heat, which was really great, because then we knew we could control the additional information that we were getting. And so, again, being a bureau that can cover each other, it really does help, like I said, the mindset of, oh, it's not my disease, I shouldn't respond. We are being cross-trained to deal with that because we are such a small bureau, and you have to wear those multiple hats. Thank you.